Let me show you everything you need to know before you integrate facial aesthetics into your dental practice. Integrating facial aesthetics into your dental practice can be an easy process if you follow a proven roadmap. However, unfortunately, there's a lot of misinformation out there. I'm going to walk you through step by step on how you can integrate facial aesthetics into your dental practice. When looking to implement facial aesthetics into your dental practice, we hear of two common concerns from our delegates. The first one is, will it work in my area? And the second one is, how do I approach my dental patients without offending them? So let's have a look at point one. Will it work in my area? We've had varied dental practices from NHS, private, mixed, and has worked in all three types of practices. So don't worry, it will work in any type of dental practice. Point number two, will I offend my dental patients? We've come up with a one sentence that I guarantee will not offend any of your dental patients on how to approach the subject of facial aesthetics. So how can you stop offending dental patients when talking about facial aesthetics and end up with no black eyes every evening? So this one sentence I used when I was a dentist at the end of each dental visit. So let's say your patient's called Mrs. Jones. I would say something along the lines of, Mrs. Jones, I know you're not going to be interested. Just to let you know, we started offering facial aesthetics in our dental practice. If they're interested, they'll interrupt you and ask for more details. If they're not interested, you haven't offended them because you already preempted by saying, I know you're not going to be interested. But what this sentence does, it makes them think of work colleagues, family and friends that could possibly be interested in facial aesthetics at your dental practice. Let's have a look at the finer details of training and certification. Obviously, I cannot speak for all academies, but I know what works for us and for our delegates that have successfully implemented facial aesthetics. There's three parts to most trainings. One, free program. This is where you should get access to online theory videos and have lifetime access so you can watch them back and forth. Second part is what happens in the training with the hands-on experience. You should be getting multiple models per procedure, but also not sharing any models. And then thirdly, what happens post-program? You should be able to get unlimited free support from your trainers to answer any difficult questions, go over any treatment planning and clinical cases. Then you will get a certificate of competence and confidence on your clinical training that you can show your insurance companies so you can get valid insurance to allow you to undertake these procedures. One important aspect we cover in our teaching is ethical considerations. Many students are concerned in their journey at the beginning of the facial aesthetics when to say no to patients, more importantly when patients have unrealistic expectations. Let's say, for example, in your clinic, a patient comes in, brings their phone out and shows a picture of a celebrity on Instagram with massive lips, and they want to replicate those results. Obviously, you have a moral obligation to say no. One of the important aspects of facial aesthetics is the compliance and regulation. This falls into two parts. The first is clinical. Obviously, as dental professionals, we adhere to a high regulation compliance and you will have no issues when you transition to facial aesthetics. The second part is the advertising restrictions that not many people are aware of. So, because botulinum toxins are POM, prescription-only medicine, there are strict guidelines on what you can advertise and what you can't advertise. What we want to do is really emphasize the consultation part. So you can say something along the lines of, we offer anti-wrinkle treatments only after a face-to-face consultation with a medical practitioner. And this lets you adhere to the compliance and regulations regarding advertising a POM. One of the fears we hear from our delegates is how to manage complications. Unfortunately, facial aesthetics, like clinical procedure in dentistry, there is an element of complications occurring. We want to equip you on how to avoid, diagnose and manage complications. So for example, botulinum toxin, we talk about baby stepping the dosages. So you're not going to get that ptosis or that droopiness. In dermal filler treatments, we talk about injecting minimal quantities that will minimize all complications associated with dermal fillers. If you want to dig deeper and find out more how to avoid, manage and diagnose complications, please click the links below in this description and download our free guide on how to successfully launch your facial aesthetics business. Hopefully you found this video useful. Please like this video, subscribe to our channel, and look forward to seeing you in our next video.